bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Are you familiar with the disease called Scleroderma? Well, I bet you're not, because there's actually only 300,000 individuals in the United States that have some form of this disease. Hello, and thanks for joining us. You're watching Comcast Newsmakers, and I'm Linda Kurtz. Joining me this hour is Liz Van Zura, and she's the Executive Director of the Scleroderma Foundation from the Delaware Valley chapter. And today we're talking about the National Scleroderma Conference in Philadelphia. Thanks for joining us today.
Thank you for having me.
As I mentioned in the beginning, only 300,000 individuals in the United States have some form of this disease. So what is scleroderma?
Okay, scleroderma is an autoimmune disease in which the body's own immune system attacks its own tissues. It's the overproduction of collagen, which is the thickening and tightening of the skin. So it can be visible on your face, in your fingers and your toes, but when it becomes internal, then it can affect your lungs, your heart, your kidneys, your esophagus, and your gastrointestinal tract. Everyone is different. Symptoms range from mild to severe, and there is no cure at this time.
And you mentioned, because we were talking earlier, that if it affects someone's hands, they almost become claw-like.
Correct.
And
yes.
They're non-functioning at that point.
Well, they learn to adapt, believe it or not. I know some people are graphic designers, so they use, they just learn to adapt and they learn to cope, and they share strategies of how to cope and do everyday things. They do things like change doorknobs in their house to handles, so that they can, go in and out of doors easily. So they do learn to adapt.
Now, do we know what the causes are?
No, unfortunately they don't.
And I guess that there's a significant amount of research to try to identify the causes.
Correct, yes. Part of our foundation is research, and we did give $1 million for researchers across the country in 2006, and they are looking into the cause and the cure for scleroderma.
Now, who is most at risk for scleroderma?
It mostly affects women. And we don't know why that happens either, and most of them are diagnosed in their 40s.
Now, as you mentioned, you're from the Scleroderma Foundation. What is your mission, and what are some of your programs and services?
Okay, our mission is threefold. It's support, education, and research. Support is, we have support groups throughout our Delaware Valley chapter, and these are groups that meet in a church or a hall or a library, and they get together, and it's people with scleroderma and their family and friends that come together to learn about the disease, learn how to cope, and they just can share stories and become lifelong friends, and that's very important when you have a disease like this. We also offer education. We are doing the national conference, which will be in Philadelphia, July 20th through 22nd, at the DoubleTree Hotel in Philadelphia. The national conference is a great opportunity for patients and families to come, because we have over 30 workshops, which are taught by top-notch healthcare professionals and researchers. So they'll come and they'll learn the latest on treatments, on research, on dental issues, on nutrition. Every topic you could probably think of dealing with scleroderma, they will cover. And it's a great place for people to meet other people that have the disease and share stories and just meet new friends that have the disease that you have. And it's going to be great, and we're very excited and proud to be the host chapter.
Now, you mentioned treatment. You also said that treatment is different for everyone. It's just, it's not like a common disease where you say, I have this, and okay, so your medications are A, B, and C. Treatments are very different.
The treatments are very different for individual to individual. It ranges from mild to severe. So it is a challenge for the doctor and the patient to find out what works for each person.
Talk to me about living with scleroderma.
Living with scleroderma, it does affect their daily lives, so they have to learn to adapt and deal and learn coping strategies. And it is a difficult disease to live with.
And you're certainly there to help them, and thanks so much for joining us today.
Thank you.
This hour's newsmaker has been Liz Van Zura. She's the Executive Director of the Scleroderma Foundation, Delaware Valley chapter. I'm Linda Kurtz for Comcast Newsmakers. Thanks for watching.